concerted action. And just to recall that, the next slide please, the Global Rehabilitation Alliance exactly is aiming at that, and our mission is to advocate for the availability of quality, coordinated and affordable rehabilitation through systems strengthening according to popular needs. And in our strategic plan that has been adopted during our last membership assembly, we need to act in a unified way among our members, but also among world regions and countries, to work together as an active partner with WHO, which is working very well in the meantime now, and to advocate for World Health Assembly resolution. So this is one of our main points. Of course, there are others, but this is one of our main focus. So we are working towards this. And in the next slide, you can have a short overview. At this point, we have 18 member organizations, which are quite diverse organizations of persons with specific health conditions and disabilities, professional organizations, organizations that focus, for instance, on specific services. Next slide gives you a short overview what has been done in the last year or 3/4 of a year, and we started to discuss about this more intensively in May 2019 at the occasion of the World Health Assembly, and saw that there is a general interest to work towards such a resolution, and especially in the Rehab 2030 meeting in July 2019, we discussed a lot with representatives of member states, but also with other organizations. But it was not clear who really could take the initiative to do that, because without an initiative, this will not happen. And so Humanity and Inclusion and GRA, we started to be more proactive, to clarify the situation and to motivate countries to work towards this. And one of these activities was to meet with representatives of the countries and the permanent missions in Geneva. And we had quite a lot of discussions there, for instance, with Burkina Faso, Kenya, Brazil, with Finland, with Botswana, and with Cameroon. And this was very positive, because all of them saw that this is an important point to be brought on the agenda. Of course, there are some problems also with the prioritization. You can imagine that, but this was quite a good experience. And there were other in discussions. One of it is very important, that the African group put this issue on the agenda of their regional meeting. And last week, Mark from Humanity and Inclusion in Geneva could represent our initiative there and give a short representation about the reason why to do that. And Valentina will later explain a little bit more how to have the narrative, how to argue towards this. And now, in parallel, we are contacting more member states. Boya, for instance, addressed to the representative of Indonesia. We have been in the executive board meeting. I now in contact with, quite difficult, but it happened that I could get in contact with the German government, and there are other initiatives, so we are moving forward. The next slide, please. This shows you some background information, and you know, maybe you know, otherwise I will mention it here, that proposals for resolutions have to be made by countries or groups of countries, and then the executive board can either accept or refuse such proposals. And so the executive board and the member states of the executive board are the key to bring this forward. It's not so much the members of the World Health Assembly, so it's a member of the executive board. Also about that, Valentina will talk more. And there was a proposal for a resolution on rehabilitation brought up by Guyana, and this proposal has been refused. And two factors are important why this happened. The one is that some member states said, well, we have the resolution on assistive technology, so we don't need another one. This is all covered. And the other one was, it's only one country, and we need a number of countries who bring this at, otherwise it will not be strong enough. So we need to be clear about this, but this should not, well, telling us to stop. And Guyana also said they are still in favor of working on that. And so we are trying to push other states or regional groups now to be involved in that. This is done on the basis, next slide please, of this document. You all know about the role of rehabilitation for the realization of human rights and inclusive development, very much focusing on the sustainable development goals, because politically this is a main well, catalog on actions that or goals that countries are committed to. And if we can show that this is linked and we contribute to this one, this will be a very strong political argument. And you will later see that we continued working with about that to bring this in shorter documents that will be more feasible to do the advocacy. But my experience and Valentina's experience, if you can hand this to a discussion partner, this is very useful and makes the discussions more strong. So what could be the key messages for a resolution? Next slide, please. This is, of course, we need to respond to the unmet needs. We need to provide a stronger political framework for the Rehab 2030, which is mainly experts. And now at the moment we can contribute to achieve the SDGs. We can accelerate the progress towards universal health coverage. And I think this is very important that we make clear that we have a common ground, which is the concept of functioning. Sometimes it seems that rehab or the narrative about rehab is quite diverse, but to be honest, the concept of functioning as an underlying concept is very much a consensus. Even some of the parts, how we apply it, could be diverse, and diversity is not a bad thing. We should ensure participation for all. Persons with disabilities are also here in the focus, a very important focus, and we have to argue that the assistive technology resolution does not cover what we need in a rehabilitation resolution, especially rehabilitation services. So what could be, what is the next step? The next slide, please. So what are our steps to move forward? Boya, next slide, please.
I already put it here.
Okay, yes, this is what, sorry, I missed that rehabilitation, of course, is in the health system. We need funding. We have to cover essential packages. We need to strengthen human resources. In many countries, there are no, for instance, therapists or rehab doctors or community-based workers. We need to have financial assistance, collect data, and engage the stakeholders. This is our philosophy, but I wanted to come to the next slide, which is now to what we need to do. And this is, we need to find or identify so-called champion states, that those who are going to move forward. Those are predominantly, or should be predominantly, the members of the executive board. So please check the list if your country is part of this. We need to create a consensus within and across the regional groups, as we started with the African region, but we also should look at the other regions. So if any one of you are in contact, please use your contacts to go towards this. We have to try to table a new proposal that well, could be based on Gondwana's proposal, but should be, well, taking into account the reactions that have been, or the responses that have been given. We need to try to find leading states there, create consensus, and hopefully we can achieve a resolution on rehabilitation. Well, we said here on this slide could be 2021, maybe more realistic is 2022, especially if we take into consideration that maybe the World Health Assembly in this year cannot be organized. So there will be a delay. I expect a delay, but this does not hinder us to work towards that. What has been done or is done at the moment? Next slide, please. This is my last slide. We had already a statement on the executive board meeting, which was a statement by Humanity Inclusion, but supported by the Global Rehabilitation Alliance, so it's working quite well. We are now looking at the task group, so we already started very closely working together, HI and the Global Rehabilitation Alliance, but other members of the Alliance, of course, are invited to approach or to join this meeting. We organized meetings with permanent missions, but this needs to be continued. We need to visit more permanent missions in Geneva. We need to meet with government officials, especially in the capital cities. And just to say something about the approach, but Valentina will go more into detail. The one thing to go to the permanent missions, but the permanent missions, of course, they tell us that they only can do what is what the governments are telling them to do. So it is good to inform them because they inform the governments, but we also need another approach, and this is what we are working today, is how at the national level the approach to the government can support this process. So we need to have two sides towards this process. Then briefings with regional groups. I mentioned that one already has happened, and then we thought about hosting a side event in WHA 2020. I'm not sure if this can happen because of the recent situation, but we will find other tools to spread out this message to officials. So this is the basis on where we are, and today we would like to inform you what is the toolkit that you could use to join this process, especially by targeting your national governments to work towards a resolution on rehabilitation. Thank you very much.